Hi everyone, welcome back to Nurse Katherine here, and welcome back to another educational video. In today's video, I will actually be questioning the CDC's guidelines on mask wearing. And I have contemplated, do I do this video? Do I not do this video? Is my YouTube channel going to be shut down because of this? Because I'm questioning an authority figure. All of that has run through my mind, but I'm doing it anyways because what I'm seeing and what guidelines are being put out there just don't make sense to me. Before we get started into the questions, I'm going to propose to the CDC and question why they're doing something and not something else and how it's contradicting itself. I am just going to give you a basic background about myself. So I have been a nurse for almost 5 years. This upcoming year will be 5 years. In 2021 will be 5 years. And I have worked in the med-surg setting, and I currently am working in the emergency department. With that being said, I have seen a fair share amount of COVID positive patients, COVID negative, all of them, you name it, I probably have seen it. When COVID started, I actually volunteered to be in the COVID area of the emergency department just because so many people were scared to be working there and they have children and I do not at this time, so I volunteered to work there. I also educated a lot of the hospital staff, respiratory therapists, doctors, hospitalists, attendings, residents, nurses, OR techs, everything. I educated a lot of them on the use of a PAPR and how to properly put that on and take that off and what setting to use that in. A PAPR stands for a powered air purifying respirator, which is recommended to wear by the CDC in COVID-19 rooms. Take that information and now let's apply that to these questions I'm going to pose. So that gives you the background on what I'm about to ask and what I don't understand from the CDC and what's just not making sense for me. I had a patient family member tell me the other day that my mask was not good enough. I wasn't sure how to take that, but they told me because I have an exhalation valve on my mask that I was spewing out particles onto all the patients. Now, with that information being said, yesterday while I was at work during our morning huddle, it was told to us we should not be wearing masks with exhalation valves in the emergency department. Since the beginning of COVID, we have had to wear N95 masks all day long, all 12-hour shifts only being taken off when you eat or drink. Because of the shortage of PPE, personal protective equipment, in the hospital I work at and nationwide, I had to wear the same N95 mask for 2 months. I have had people tell me I'm a liar because of that, I'm fabricating, but I actually have worn the same N95 mask for 2 months straight. The straps have snapped off. I had to take a tourniquet, an orange tourniquet band that you would put on your arm to get blood work. I've had to staple that to my mask in order to even be able to wear an N95 mask. If I couldn't wear that N95 mask, or if there was one that did not fit me, I had to wear a PAPR, that big hood with the power pack that goes around your waist, which is recommended by the CDC to wear, as well as an N95. But now these masks that have exhalation valves, including N95s that have exhalation valves, are not recommended by the CDC. So with all of that information, let's compare what the CDC is recommending about N95s, surgical masks, and PAPRs, and why we can't wear exhalation valves, which makes no sense why we cannot wear an exhalation valve, but we can wear a PAPR. So let's go onto the CDC's website and just kind of deconstruct and kind of pull this apart a little bit. So let's talk about this exhalation valve I keep talking about. An exhalation valve can be a one-way valve allowing air that you are breathing out to be put out into the environment, which is unfiltered. With that being said, that's why everybody is wearing masks, because air that's coming out of a mask is not always filtered. That is also including a surgical mask or a cloth mask. Those don't have a proper seal onto your face like an N95 mask. A surgical mask prevents big droplets from getting out, but not small droplets from getting out. Hence, why the other person or you yourself should be wearing a mask to help filter those other particles that are not being filtered by the other person's mask. Now, with all of that being said, let's read about what the CDC has to say about using a surgical mask in a hospital, an N95 mask, and a PAPR. Before I read that, I just want to remind you that a PAPR has giant holes in the bottom of the mask. It is positive pressure air. It is air spewing out of the bottom of the mask, and the wearer is not wearing a surgical mask or anything else underneath the PAPR. So I am under on the CDC website. Why does CDC continue to recommend respiratory protection equivalent or higher to the level provided by an N95 disposable filtering face piece? Let's stop there. No N95 that I have ever been given or have ever been seen by a hospital has a filtering face piece. The one I bought myself for $70, created by Envo, link above right there to my video, has a filtering face piece, but has the exhalation valve on it. Anyways, for care of patients with known or suspected COVID-19. So here we go. I'm going to read this. This is directly off of the CDC's website. Face masks commonly used during surgical procedures will provide barrier protection against droplet sprays contacting mucous membranes of the nose and mouth, but are not designed to protect wearers from inhaling small particles. N95 and higher level respirators, such as other disposable filtering face piece respirators, powered air purifying respirators, that's your PAPR, and elastometric respirators provide both barrier and respiratory protection because of their tight fit and filtering characteristics. So the CDC is telling us that we as healthcare providers can wear a PAPR while we are at work, and also an N95 while we are at work. With N95s, we are mask fit tested to those specifically. There is a wide range of a testing that we need to go through as healthcare providers when we have a job in a facility and need to be wearing an N95. This is a yearly training that I have had to go through since I've been at my hospital system. Because of COVID and because of the short supply of N95 masks that we have had, we have not been able to have this training because it's a waste of a mask to use just for training purposes. So with that being said, N95s do not fit everybody. So if you do not fit an N95, you must wear a PAPR. That also goes for men who have facial hair. If you have facial hair and you are wearing an N95, you will not have a proper seal and you cannot wear that. So you'll have to wear a PAPR. A PAPR, reminding you, has giant holes in the bottom that is spewing out air, but we're not allowed to wear a N95 with an exhalation valve that's releasing air. Now I want to get under masks with exhalation valves or vents on the CDC webpage under the public information. Let me read this to you. The purpose of masks is to keep respiratory droplets from reaching others to aid with source control. Masks with one-way valves or vents allowed exhaled air to be expelled out through holes in the material. This can allow exhaled respiratory droplets to reach others and potentially spread the COVID-19 virus. Therefore, CDC does not recommend using masks if they have an exhalation valve or vent. And that is my point. I don't know if I'm the only one who has ever posed this question or questioned authority, if you want to say it like that. But why is it that if I don't have an N95 available to me, I would have to wear a PAPR? PAPR, again, releasing all those particles out to the entire floor area that I am working in because I don't have an N95 and I am not recommended to wear a surgical mask underneath that PAPR. The PAPR is specifically only for my protection. It is not protecting the patient. Our patients are wearing masks as well. But should I not be wearing a surgical mask underneath the PAPR? Which nowhere does it say that on the CDC's guidelines that I should be wearing a mask underneath the PAPR. And quite frankly, when we were doing PAPR education at the hospital I'm at, we were instructed not to tell people to wear anything underneath the PAPR. So this is where I have a problem with all this information coming out is Disney World is banning masks with exhalation valves. Airplanes are now banning masks with exhalation valves. But then I, as a nurse who see COVID positive patients weekly, can wear a PAPR, but spew out my germs onto the patients and everyone around me. But I can't wear my N95 with a one-way valve. And yes, I know it's an easy fix. I can throw a surgical mask over top of my N95, or I can put a surgical mask on underneath of my PAPR. But why is it that that is not being recommended by the CDC? And why is it that N95s with one-way valves or just a simple surgical mask with those one-way valves that a lot of people are wearing out in public are now being banned? And they're saying not to wear those when I can go into the hospital and wear a PAPR and spew out my particles all over everybody. So all in all, I would love to see a study that shows the difference between a surgical mask, a cloth mask, one of the gator necks that they are also now saying do not wear, and also an N95 with an exhalation valve, and also a normal surgical mask with an exhalation valve, or cloth mask with an exhalation valve. Because all of this information seems to be contradicting itself. So if you know any other information that I do not know that is being recommended by the CDC and is on the CDC webpage that I am not seeing, please comment below because I would love to know the difference and the percentage of droplets that is being expelled by each mask and which ones are more effective than others, rather than just saying, oh, this one allows droplets out, because they all potentially will allow droplets out, especially that PAPR that is being recommended for me to wear. So that is my rant, guys. That is the end of this video. I hope this brought some questions to mind for you all, because I know I am still totally confused on what mask is better, because I am there to protect my patients, but also to protect myself. But wearing a PAPR doesn't seem like it's protecting my patients. Wearing a surgical mask does not seem like it's protecting my patients. Wearing an N95 with an exhalation valve is not protecting. And wearing a normal N95 I can't do because there are none for me to wear, which would then make me wear a PAPR, and then we're back into this whole cycle again. So that is it. Rant is over. Please comment, like, subscribe, share this video to get the word out there what I am posing as a question, and maybe I can find an answer through this, and maybe the CDC can even find out an answer for me. So other than that, have a very blessed day, and I will see you in Saturday's vlog style video. Don't forget to subscribe.